Welcome to Wellspring on the Air. I'm Nicole Alfonso, a therapist at Wellspring and the host of today's show about end-of-life care. Today on our show, we have Ivana Guzman, which we're excited to have. Thank you, Ivana, for choosing this topic. I think it's a special and important topic, a topic that we don't often like talking about. So thank you.
Thank you for having me.
Of course. So thank you. And I want to just give people a little bit of info about you. So if you could just introduce yourself and tell them what you do here at Wellspring.
Well, hello. I'm Ivana. I am a registered mental health counselor at Wellspring. Recently started full-time at Wellspring, building up that client load, being part of the amazing programs like Bounce that Wellspring has and does for the community. So a little bit about me. I love reading. I like puzzles, kind of those brain games, really interested in being outdoors in the sense of like hiking and doing fun activities. But yeah, that's a little bit about me. Very
awesome
things.
I just learned something new about you, that you're a puzzle person.
Yes, I love jigsaw puzzles.
That's awesome.
Love them. Mm-hmm.
Okay, so let's go ahead and dive in. End of life care. What does this mean? When we talk about this, what is this like? I feel like there's a lot of different components to it. So could you share a little bit about what does that mean?
Definitely. So there's not really a set definition or interval for what end of life care is. In the medical field, through that medical model perspective, there's different ways to refer to end of life care as well. Some terms that may sound familiar are hospice care, palliative care, terminal care. And there's some distinctions between them as well. The two most common ones are palliative care and hospice care. And a lot of people think that they're the same, they're interchangeable, but in reality, they're a bit different. So I'm going to describe what those differences are, just so we get a clear picture of what we relate to when we think about end of life care. So palliative care is care provided to anyone with a serious illness. It could be at any point in time. It's meant to enhance care by focusing on the quality of life of the patient and of the family. And like I mentioned, it's a resource helpful at any stage of the illness. The earlier, the better, because it helps the patient and the family process the illness, the steps and the care and the healthcare involved throughout the process of the illness. But it doesn't mean that you're giving up on treatment. It's just extra, it's like an extra resource for the family and for the patient during this difficult time.
Yeah, and so it's not terminal. The client doesn't have to be terminal to receive palliative care. Okay, got it.
Now with hospice care, that's where the big difference is. Hospice care focuses on the care and the comfort and also the quality of life of the patient. However, this patient is approaching death. Usually the doctors, the medical team says that they have about 6 months or less to live if the illness takes its natural course. So it kind of has that time limit, hospice care. You need to be in this time frame to qualify for hospice care. This is also used when there's no treatment available for the illness, or the treatment isn't working, or the patient has decided that they don't want to continue in the treatment because they feel that it's better for them to just live out the rest of their days without taking medication or doing procedures and just spending time with family. So there's that time component, and there's also that autonomy component of maybe I just don't want to keep doing all these treatments, or why continue if the treatment isn't working? So hospice care comes in and provides that care and that comfort and that quality of life to the patient at that time. So I also want to mention that doesn't mean that we're just going to let that person suffer and just be in pain all the time. Hospice care is really the attempts to cure the illness are stopped, but symptom relief is still provided. So pain management, pain medication, although are still involved and incorporated into hospice care.
Yeah, to take away all the uncomfortable just feelings and pain, right?
Right.
That the illness could be causing, so that the death is more peaceful and not so traumatic, right? Yeah.
Exactly. Yes.
Okay, so let's talk about why it's important to actually have a plan, right? Because I feel like it's kind of like you don't want to like talk about it or discuss, because it feels like you're giving up hope, right? When you think about, well, let's plan if we need this or that. But really, it's actually a relief in a way to have a plan, right? So let's talk about that, because I think it's important.
Yes, definitely. So it's definitely important to have these conversations and have a plan for end of life, especially if it is a terminal illness. If you know that's kind of the path that eventually, the illness is going to take. But it gives also hope in a sense to the patient as well, because they get to choose what that plan is. So there's autonomy there. And that's a very big benefit to the patient and ultimately as the family as well. Having those open discussions early on is even better, because everyone's kind of on the same page and the client's wishes, the patient's wishes are upheld. It also just increases, and research shows it increases the compliance with medical team and patient goals and the medical team goals. It increases patient satisfaction in the medical setting and the healthcare setting as well, which then in turn makes the whole kind of experience of struggling with a issue, illness, disease easier on the patient and on the family. And so it's something that's really important to do. And like I mentioned, the earlier, the better, because then you know what you want before perhaps the illness takes, control of your mind, your cognitive abilities.
Right. And you no longer can make decisions. Exactly.
Right.
Yeah.
And that's where I also work at a hospital. So that's where I see a lot of issues sometimes pop up, is when the patient has that lack of mental capacity and the plan wasn't set. And then it really turns into kind of a legal battle or a medical care battle.
Yeah.
What do we do between the family and the friends? And it stops becoming less about what the patient wants and wanted, and more about what the external factors and the family and friends may want. So the importance, I would say one of the biggest importances for having these conversations and having an end of life care plan is so that the patient, the one person kind of struggling and dealing with the physical and the mental aspects of the illness, has the say on what happens to them and how it happens to them.
Yeah, that's so important, I think, because it can get so complicated, right? And chaotic, and even separate families when they have to make these decisions and it's not been in place. So it really is overwhelming. And so it's necessary if you want to maintain some sort of peace throughout the process, already a difficult process, right?
Yes, definitely. And, research shows that one of the top 5 barriers to patient goals for end of life care is that lack of mental capacity. So there was a study that showed that cancer patients coming in admitted, about 79% of them admitted, came in with mental capacity. They can make their own decisions. They had their own say in the medical care and the course that it took. But 40% of those patients lost capacity before any actual plans of end of life care could be discussed or even had.
Wow.
So
That's
40% of those patients went through this illness, end of life, passing with perhaps complications and that conflict between family and decision making, because they lost that capacity throughout the progress of their illness before the conversation was even had. So it's really important to have those, like I said, early on, so that we can avoid that barrier.
Of course. And I think it's a really important thing to make the distinction of having these conversations does not mean giving up hope, right? It just means preparing so that things are smoother, right? So things can flow better and the client or the patient feels taken care of, right? And relieved. from all the symptoms and all the negative pain that they'd be having. So I think it's huge. My husband does wills and trusts. So he does this whole preparing, okay, who are you giving what to, what is happening, when you have to make medical decisions and all that. And it can be so difficult if that's not in place.
Yes.
And again, it's really about taking care of yourself and your family and planning well.
Right. And
again, not giving up hope, but
right. The better
our lives are in God's hands,
Yes.
so we don't know what's going to happen. Right. And so,
right. And the better you're prepared, right. Like you mentioned, the easier that illness and that difficult situation will be, because you don't have to worry or stress about those things. They're already
right.
set in place. You can set them away, put them in a drawer. And when it's that time, everybody knows what the patient wanted, what everyone was discussing. It doesn't have to be a solitary thing either, right? Patients can come to the final conclusion, and will come to the final conclusion of their plans on their own, because it's their own life and journey. But the family, the people who are important to them, the medical team even, can be involved in these discussions. So it's not something that the patient does all on their own. It's something that's discussed with a support team, with a medical team, looking at what is the best option, or what are the options to make that plan the best for that patient.
So you're leading into that piece of preparing, like, how does families and friends prepare for this? Practically speaking, what steps do they take,
Right. And, like you mentioned, this could be a very sad and heavy topic, and sometimes even a taboo topic of a lot of people don't like to talk about it. But like we've been talking about, these conversations are important and can also, I feel, bring hope to the situation. Because you now have hope that, okay, even if things take a turn for the worse, we have this set in motion and this plan, and we know that it's what our patient or our family member wants, and that it's going to be an easier transition, right? It's going to be less stressful. It's going to be less traumatic, like you mentioned. But beginning that conversation can be also difficult. How do you even approach, your family member or friend who's dying or in critical condition about, hey, what are your plans about,
what do you want?
Treatment doesn't work. What do you want if, the worst comes to happen? And really, I think it all starts with the patient as well, when they're ready to talk about it. So the medical team, you as family friend, will gauge that person, and hopefully you have a relationship with that person if you're having this deep discussion and this personal discussion, and just gauge if they're ready, if they're been thinking about it, they're open to talking about end of life care planning. And then just involving those people who are knowledgeable, right? The medical team, doctors, nurses, mental health therapists, even nutritionists, anybody that can have a professional opinion or information on what the process entails. What does it actually mean? What could it look like for you? Because every patient, every illness is going to be different and take a different course for each individual. So having that medical team involved in that conversation, again, once the patient is ready, is very critical. And also in the sense of the patient asking questions, not being afraid to ask those tough questions to your medical team, to your mental health professionals, to your family, being informed and being involved, again, that piece of autonomy in all your options, right? And taking the time, again, right, to think about what you want for yourself, what you value, what you believe in, incorporating all of that and having those open discussions is one of the first steps and several steps that the patient can take.
And so the patient, does this, and you as family and friends, you help in this process of what would you like if, and then there's this really important piece that I think we sometimes have difficulty with, which is respecting what the patient decides, right? And as family and friends, it's often like, no, but you should try this, or you should try this, right? but ultimately it's their way of ending life and they want to decide. And so we should be respectful of that, right? And what if we're struggling with that as a family member or as a friend?
Yeah, definitely. It's going to be very difficult also for not only the patient, but the people around them, the people who love them and support them and have been with them for a long time. So some things the family can do, family and friends, is if they're having that struggle with respecting those wishes, right? They disagree, they want them to keep fighting and doing all these things. It's going to seek help from a therapist or a counselor, a pastor, or someone that they look up to, or that someone who's had that experience before, right? Getting that knowledge from someone to try and process and understand the choices that the patient has made, to get to that respecting those wishes. It's not going to be easy. It's a difficult journey for everyone involved, but just that same openness that the patient has to have in talking about that discussion and those plans, the family and friends have to take that same approach in opening up to professionals, to trusted friends, to other people who have gone through it, and really just begin to process and understand and work through those feelings and those hopes that maybe are disappointments, to get to that level of respect for the patient's wishes, and just continue to be that support, even if there's some tension there or disagreement.
Yeah, difficult, but important to have a support system either way, right? As a patient or as a family member.
Right.
Yeah.
So as a family, you can't just be the only support to the patient.
Yeah.
You also have to have your other, your own supports.
Yes. Your people that you could, So how does having a plan or not having a plan affect mental health of family and just the people around the patient?
Yeah, so there's research shows that there's a very big impact on both patient and families if there's no plan or steps in place or no discussions had. So kind of on the medical side, there's more patient satisfaction, right, with the medical care and the team, as we mentioned before. Families are also more satisfied with the care that their family or friend receives. So that takes the stress off of, are they treating my family member correctly? Are they treating them well? Are they still doing everything they can? If they have a plan in place, those worries kind of dissipate. Now the lack thereof, right? There's more unsatisfaction with the team. If there's no plan in place, family participation can get involved. And like you mentioned, sometimes it gets really tricky, especially with a big family. I've seen that a lot kind of at the hospital where there's several kids, for instance, and their parent is in the hospital and they all have different opinions and can't agree to something. So that not only causes tension between the family unit, but also causes problems for the patient, right? They don't get the care as fast as they needed or the care that they actually need. There's a lot of back and forth. Again, causing stress. Research shows that those families are more prone to depression and PTSD as well. So and then they also perceive that their loved ones didn't receive good quality care or end their life on good quality terms. So then you can have guilt, regret come in, leading, or contributing to that depression and that very intense mental state for the family.
Overall, it's just better to plan. It's just better for everyone, their mental health, their the way they view the death, everything. It just seems like it's a better outcome when you're prepared.
Yes. So with preparation, we see that we increase family participation in those discussions, and then they are less likely to develop depression or complicated grief or PTSD. There's also less psychological burdens on the bereaved family and friends, right? So we see that decrease in mental health issues when there is a plan. So we see the opposite when there isn't a plan.
Of course. Yeah. Wow. So of course, anyone listening that is in this situation right now, this is the plan, and getting the care is the better option overall. So let's talk about the biblical piece of this. We always like to discuss, what does God say? How does faith play a role in the end of life care? Tell us a little bit about that.
Yes. So there's several myths that kind of run around about end of life care, kind of those two that we mentioned, palliative care and hospice care. The myth kind of that it's assisted suicide or euthanasia or something like that. So a lot of people are put off by this topic in general, right? Because of that. But like we mentioned in the beginning, that's not what it is. It's just quality of care in that end life stage. It's that care and comfort, that pain relief that comes from that illness that is taking that route. And so faith, religion, those beliefs, they're all incorporated into the discussions and the decisions of end of life care planning. Like we have talked about, the patient ultimately decides what they want, and they take that all into consideration. Part of the team that can talk to the patient and family is, pastors and people of faith that they may be close to or relate to. But as I was doing, research for this topic, more specifically on that topic of faith and how end of life care and how they kind of come together, I found this report, and it mentions 4 biblical principles kind of related to end of life care and dying, really. And so I'll briefly kind of mention the verses that they go through to give us that biblical perspective, right?
Yes.
Straight from the source. So the first principle comes from Philippians 1, chapter 1, 19 through 26. And it says, I trust that my life will bring honor to Christ, whether I live or die. For to me, to live is Christ and to die is gain. So really, this principle, the report says, it's God's glory is our ultimate aim, right? So you're torn between 2 desires here, right? Whether you're going to stay here on earth and live and continue, or if you're going to go with Christ, right? And ultimately, he says, I long to go and be with Christ, which would be far better for me. So we see that in the Bible that, yes, there is that we want to stay here, but we want to go. What's better? Well, the Bible tells us, leave earth and go to your Heavenly Father, right? So that's something that can play into this planning. The second principle, there is a time to cease resisting death for the glory of God. And that principle stems from Ecclesiastes 3, 1 through 2, right? For everything, there is a season, a time for every activity under heaven, a time to be born and a time to die. So we see that there's a time for everything. And so sometimes, and the report concluded that in light of all the of scripture, this can include the time to stop resisting death, right? By which means of measures that are minimally effective or that have serious side effects, right? Why are you resisting something if treatment isn't working, or if it's causing so much distress and side effects in your life here?
Yeah.
And then the third principle is the Bible does not require that we suffer merely to extend our physical life, but life is not to be abandoned simply on account of suffering. And that comes from John 21, 18 through 19. And it says, when you are old, you will stretch out your hands and others will dress you and take you where you don't want to go. Jesus said this to let him know by which kind of death he would glorify God. So it kind of shows that, yes, during the end stages, you have people who are going to take care of you and lead you through this. And that's okay. Continue in, being led in that way. But don't worry, right? This is the natural way of things going.
Exactly.
And then the last one, which I think I think is more the most applicable one, or I think the one that we can see more as, okay, yes, this makes sense. It's an action step kind of. Says when death is likely to occur within a short period of time, it should be faced with realism and readiness. So kind of what we've been talking about being prepared and planning. And that comes from Genesis 49 through 50. Those stories where both Jacob and Joseph are taking steps to be reconciled with others and to speak of God's promises to their loved ones as they're nearing their death. So even as these two biblical, persons are preparing for their own death, they're old, they know that it's coming. They're talking to their family and their friends in the community, preaching, God's word, preparing them so that when they pass, they're okay. They know what to do next. So this, I feel like, relates and kind of puts everything together in what we've been talking about how being prepared and planning can be a huge benefit to not only the patient, but to the family and the people around them in preparing them for life after, even for them as a whole unit.
Absolutely. I think, in a lot of things in our lives, we should be prepared, right? And we should plan for our future. And this is just another thing that we should be prepared and plan for. As difficult as it is, it will make life smoother, easier, and in the end, more dignified for the patient, yes. Right? Wow. Thank you, Ivana, so much for bringing on this topic and coming on and sharing with us. I know you have even personal experience with these struggles in your other job as a nurse. So I'm thankful that you brought that as well. So it is time to close out this show. Thank you again, Ivana, for joining us today and helping us learn about this end of life care and how important it is to plan. We hope that this show was helpful to all of you that were listening. And again, thank you for joining us. We hope that this was helpful. Encourage us and let us know you're listening by sending comments or questions to ontheair@wellspringmiami.org. It's time to wrap up. This is Nicole Alfonso with Wellspring on the Air, because hearts and minds matter.